Good afternoon. My name is Jasmine Anderson. I am the immunization education specialist for the Partnership for Maternal and Child Health of Northern New Jersey. Today's webinar will be focused on childhood and adolescent immunizations that are required to attend a New Jersey child care center or K through 12 school. August is back to school season, and it is also National Immunization Awareness Month. This month is an annual observance that highlights the importance of vaccinations for all ages. But today, we are talking about the children. This activity is supported in part by the New Jersey Department of Health Vaccine Preventable Disease Program. At the conclusion of this webinar, you will be able to explain what vaccines are and how vaccines work, explain why childhood and adolescent immunizations are important, discuss what vaccines are recommended for children and adolescents, and lastly, discuss what vaccines are required for New Jersey child care and schools. The United States is seeing a resurgence of vaccine preventable diseases because of low vaccination rates. Vaccine preventable diseases spread among unvaccinated and under-vaccinated people, including babies and children. This year, we've seen outbreaks of diseases that are not currently prevalent in the United States. In the year 2000, measles was declared eliminated in the United States, meaning it was no longer naturally occurring or prevalent in the United States. However, measles was and still is prevalent in other parts of the world. That means that anyone who is not vaccinated against measles can catch and spread measles to other unvaccinated people. In 2024, there have been 167 cases of measles to date. Almost half of those cases were cases in children under 5. 31% of those cases were cases in adults ages 20 and older. And those adults were more than likely unvaccinated or undervaccinated. And 84% of the cases were in people who were unvaccinated or whose vaccination status was unknown. According to the CDC, there have been 13 outbreaks this year in the United States, and 66% of the 2024 cases are associated with an outbreak. 53% of the US cases resulted in hospitalization. 61% of the cases in children under 5 led to hospitalization, and almost half of the cases in children 5 and older and in adults also led to hospitalization. This data tells us that measles infection can be serious in most cases. At this time, measles activity in the United States is low. One of the measles outbreaks in the United States occurred in Chicago in March. In total, Chicago had 64 cases of measles in 2024. 52% of those 64 cases were in children between the ages of 0 and 4. In May, the CDC reported that 57 measles cases were associated with residents in or contact with people in a migrant shelter in Chicago, and that most of these cases occurred in unvaccinated people. Both the US and Chicago data indicate that measles is impacting young children at a higher rate. It's important to note here that children do not begin the 2-dose measles vaccine series until 12 months of age, and they complete it between the ages of 4 and 6. As we saw in the last slide, 84% of the US cases were in people who were unvaccinated against measles or whose vaccination status was unknown. And so we can assume that the majority of the children who were infected with measles this year were not vaccinated. There are also pertussis outbreaks taking place around the world. This means, unfortunately, that unvaccinated people who are traveling can catch pertussis anywhere and can spread it to wherever they travel to or to people back at home. So this article that we see here was published on April 17th of this year. The United States has reported some cases and outbreaks. In fact, New York City experienced an outbreak between October 2023 and early 2024, with more than 200 of those cases being cases in young children. To the right is an excerpt from the article. It's recommended that anyone seeing a new baby should have a Tdap booster, which protects against pertussis, and that pregnant people should get a Tdap booster with each pregnancy to offer their babies early protection. I'm now going to provide an overview of vaccines. I'll discuss what vaccines are and how they work, why children and adolescents should get vaccinated, the recommended immunization schedules for children 0 to 18, and New Jersey's immunization requirements for childcare and schools. Vaccines are safe, simple, and effective tools that protect us from pathogens before we encounter them. Pathogens are viruses or bacteria that can cause disease. And so viruses can include the flu and COVID-19, and bacteria can include tetanus and meningitis. Following video explains how vaccines work. Just want to add the caption.
When your child gets a vaccine, an amazing thing happens. Just like a teacher, the vaccine gives your child a lesson. The immune system gets to work right away, learning what to do if your child is exposed to harmful germs. All of us are exposed to germs every day. Some might cause a cold or a minor illness. But then there are more dangerous viruses and bacteria that can make children very sick. Diseases like measles, diphtheria, and polio used to sicken and kill thousands of children. That's why it's important to get vaccinated, so your immune system will know what to do. Here's how that works. Vaccines contain either an antigen, a piece of the germ, or some instructions that tell us how to make the antigen. They teach your immune system to produce antibodies to get rid of the virus or bacteria. Then, those antibodies remember what to do if your child is exposed in the future. Vaccines can work in a few different ways. In some vaccines, the antigen is a virus that has been weakened. This means it will not be able to reproduce in your body to make you sick. But it does a great job of teaching your immune system to be ready for the real thing in the future. Other vaccines use a virus that has been killed, a tiny piece of a virus or bacteria, or a weakened form of a toxin, like the kind produced by the bacteria that cause diphtheria and tetanus. Same thing, it can't make you sick, but it teaches your immune system to recognize the germ. Getting one or more doses of a vaccine later on gives the immune system a memory boost, so it remembers what to do. The recipe for most vaccines is pretty simple. Besides the antigen, some vaccines contain aluminum salts, which help make the antigen work better, so children can get a lower dose. The amount of aluminum in vaccines is small, much less than your child gets from everyday food and water. Some vaccines also include a preservative to keep germs out and tiny amounts of other ingredients, all very safe. After your child gets a vaccine, their arm may feel sore or they may get a fever. That's a sign your child's immune system is getting stronger. After the vaccine does its job, it leaves the body and is gone. A week or two later, your child's immune system is better able to protect your child. Remember, vaccines have been given to millions of children and teens. They are closely studied, and we know they are safe and effective. In fact, vaccines work so well, most reduce your child's risk of getting these diseases by 90% or more. It's an amazing way to protect your child so they can stay healthy and safe.
Smallpox was completely eradicated thanks to worldwide vaccination efforts. So diseases are either declared eliminated, meaning that the disease is no longer circulating in a specific area or region, or diseases are declared eradicated, meaning that the disease is no longer circulating worldwide. Oh, I'm sorry. Smallpox was one of the most devastating diseases known to humanity and caused millions of deaths before it was eradicated by the smallpox vaccine. The smallpox vaccine was the world's first vaccine ever created by Edward Jenner in 1796. Successful use of the smallpox vaccine led to the gradual reduction of smallpox cases. The last U.S. wild smallpox case occurred in 1949. After intensive vaccination campaigns in the 1960s and 70s, the last case of wild smallpox in the world occurred in 1977. Routine vaccination against smallpox ended in the United States in the early 1970s as its incidence lessened. Smallpox was then declared eradicated from the earth in 1980. There are three reasons why children should get vaccinated. Number one, vaccines can save your child's life. Many of the vaccine preventable diseases have serious risks and complications, including death. Some risks and complications can be lifelong, but vaccines prevent those risks and complications from happening, and many even prevent illness altogether. In addition, as we just learned, it is possible for harmful diseases to be completely eradicated by vaccines. Number two, vaccines strengthen your baby's and your child's immune system. Immunity is the body's way of preventing disease. Because a baby's immune system is not fully developed at birth, babies face a greater risk of becoming infected and getting seriously ill. Vaccination protects your baby by helping build up their natural defenses. As for your older children, immunity from vaccines can wane over time, so getting an additional dose of a vaccine at a later age gives your child's body a memory boost. Additionally, risks of other types of infections, such as meningitis, increase as your child ages. For this reason, some vaccine series will begin when your child is an adolescent. And lastly, vaccines protect your loved ones, your community, and future generations. When you get vaccinated, you help prevent the spread of pathogens. Stopping the spread of pathogens is extremely beneficial for those who may not be able to get vaccinated and for some of our most vulnerable populations, like older adults. And as we just learned, smallpox was eradicated thanks to the efforts of previous generations. So we don't have to worry about the fear of smallpox, and we no longer have to get vaccinated against smallpox. And so it is possible for more diseases to be eradicated for our future generations. This is the recommended vaccine schedule for children ages birth to 6. It was developed by the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians for all the recommended childhood vaccines and when they should be given. It is important to follow the recommended immunization schedule for several reasons, and I'll review those in a few slides. But the most important reasons are that this schedule considered the ideal timing for when children should be vaccinated, and the schedule ensures that children receive early and long-term protection. So this schedule is available online for reference, and this schedule also has a second page that explains which diseases each vaccine protects against, what the complications are, and things like that. So it's a very useful tool, and I can actually provide that at the end of the presentation. And this is the recommended schedule for children ages 7 to 18. Any child in this age group who is missing any of the vaccines from the previous schedule can catch up. Parents will just need to discuss this with their pediatricians or a healthcare provider. It is safe to give your child multiple vaccines at once. So if you saw, I'll actually go back. So if you saw in, I'll show you this schedule. So if you notice that there are multiple vaccines due for like different ages. So like the 2 month, we have doses for rotavirus, DTaP, Hib, etc. And oftentimes parents think that, oh my gosh, like my child is gonna get 5 needles in their arms, and that's not necessarily the case. It is safe to give your child multiple vaccines at once. So according to the CDC, scientific data show that getting several vaccines at the same time does not cause any chronic health problems or overwhelm your child's body. Several studies have been done to look at the effects of giving various combinations of vaccines. And when every new vaccine is licensed, it has been tested along with the vaccines already recommended for a particular age child. The recommended vaccines have shown to be as effective in combination as they are individually. And so, when your child is due for multiple vaccines, these vaccines may be combined in combination vaccines. Ultimately, your child will only receive 2 to 3 needles and not a needle for every vaccine. So, let's talk a little bit more about combination vaccines in this next slide. Combination vaccines take two or more vaccines that can be given individually and puts them together in one shot. So, at a doctor's office, your child may only get 2 to 3 shots to protect them from 5 diseases instead of 5 individual shots. There are several benefits for combination shots for children and parents. For children, it means less pain and discomfort, and on-time protection and fewer shots. And oftentimes, parents ask to space out the vaccinations for different reasons. However, spacing out the vaccinations could mean more time that your child is unprotected, more visits to the doctor, and repeated pain and discomfort. And so, combination vaccines just kind of eliminate all of that. Okay. And for parents, the benefits of combination vaccines are fewer trips to the doctor, less hassle and cost, and less time off from work and from family activity. So why follow the recommended immunization schedule? Number one, ideal timing. The schedule is based on how your child's immune system responds to vaccines at various ages and how likely your baby is to be exposed to a particular disease. Number two, prevent complications. Delaying vaccines, as I mentioned, could leave your child vulnerable to diseases when they are most likely to have very serious complications. So as I mentioned at the top of the presentation, babies' immune systems are extremely underdeveloped, and so they are our most vulnerable population when it comes to these diseases. Number three, early protection. It's best to vaccinate your child before they are exposed to dangerous diseases. And so if you wait until you think your child could be exposed to a serious illness, like during a disease outbreak or when they start daycare, there may not be enough time for the vaccine to work. Usually it takes about 2 weeks for the body to develop antibodies. And so you want to get them vaccinated way in advance so that they have the proper protection. Number four, it is the best protection. Children won't have the best protection from serious vaccine preventable diseases until they get all the recommended vaccine doses. Number five, long-term protection. Many vaccines offer lifelong immunity against diseases. In addition, maternal antibodies and breastfeeding don't provide enough protection. And so some vaccines, like the flu vaccine, is encouraged for pregnant people and moms to get while they're pregnant because they are able to pass the antibodies onto the baby while they're pregnant. And they can also pass antibodies to the breast milk. However, that's passive immunity and it doesn't offer long-term protection. And then in terms of lifelong protection, lifelong immunity, the measles vaccine provides lifelong immunity as well as the chickenpox vaccine. I always tell this story. I got the chickenpox vaccine when it first came out, 1995. That was actually the year I was born, and I've never had the chickenpox. And I compared to my older family members, even cousins that are a couple years older than me who have had chickenpox, I luckily did not experience that because I was vaccinated. And lastly, spreading illness. Children who are not vaccinated on schedule are not only at risk of getting sick themselves, but they can also spread illness to others who aren't protected, like newborns who are too young for vaccines and people with weakened immune systems. So these are all the reasons why we want to follow that recommended immunization schedule. So several immunizations are required for children to attend schools and daycare. These are the immunizations that children need to attend any child care facility or preschool in New Jersey. The chart explains which dose your child should receive at which age. Children attending child care facilities or preschools need to get the following immunizations: DTaP, polio, HIB, pneumococcal, MMR, which protects against measles, mumps, rubella, varicella, which protects against chickenpox and flu. And I'm going to do a deep dive of these diseases and vaccines in the next part of the presentation. But I just want to point out what is required for children attending childcare and preschool. And these charts can be found on the New Jersey .gov website. These are the immunizations that children need for kindergarten to fifth grade. This chart is different from the previous one in that it shows the minimum doses needed for each vaccine for a child who is in any grade between kindergarten and fifth grade. So for children in K through 1, the following vaccines are required: DTaP, polio, MMR, varicella, and hepatitis B. So that's different from the last chart that we watched. Hepatitis B is the new addition. And then for children in second and fifth grade, the following vaccines are required: DTaP, which children should have received, but if they need to catch up, there is a catch-up schedule for DTaP, polio, MMR, varicella, and again, hepatitis B. So again, by the time children are in second and fifth grade, they should have the majority of these vaccines, but in the event that they don't, they're able to catch up. And then these are the immunizations that children need for sixth grade and older: DTaP, polio, MMR, varicella, hepatitis B, Tdap or meningococcal Tdap. And so meningococcal Tdap actually combines the meningococcal vaccine and the Tdap vaccines. And again, all of these charts can be found on newjersey.gov. Now we're going to learn more about the diseases for each required vaccine and the vaccine recommendations for each vaccine. So first, I wanted to just show a couple of images. Many people today may not have seen what many of these vaccine preventable diseases look like. For that reason, many feel that vaccines are not necessary. And so we have a few diseases here that have visible symptoms that we can see with our own eyes. Many of the diseases that I am going to discuss have symptoms that we can't necessarily see without imaging or technology. But I just wanted to emphasize the severity of a lot of these vaccine preventable diseases, the suffering that children end up going through, and adults as well. And I'm just trying to make it a little bit more tangible for everyone. So let's start with diphtheria, tetanus, and pertussis. So diphtheria is a bacterial infection that makes it difficult to breathe and swallow. It attacks the heart, kidneys, and nerves. Diphtheria spreads through the air and direct contact, and symptoms include sore throat, mild fever, weakness, swollen neck, and swollen neck glands. Risks of diphtheria include swelling of the heart muscle, heart failure, coma, paralysis, and death. Tetanus is a bacterial infection. The bacteria that causes tetanus lives in the soil and causes lockjaw. Tetanus is the only naturally occurring vaccine preventable disease, and it does not spread from person to person. It spreads through breaks in the skin, which include wounds, puncture wounds, and burns. Risks of tetanus include broken bones, difficulty breathing, and death. And then symptoms include stiffness in neck and abdominal muscles, difficulty swallowing, muscle spasms, and fever. And lastly, pertussis, also known as whooping cough, is a bacterial infection that causes violent coughing fits. So symptoms include severe cough, running nose, apnea, and risks of tetanus, risk of pertussis include pneumonia and death. And as mentioned earlier, pertussis can be extremely dangerous for newborns. It is recommended that children receive 5 doses of the DTaP vaccine at the following ages: 2 months, 4 months, 6 months, 15 months, and age 4. And then adolescents will receive an additional vaccine dose called Tdap at age 11, which protects against the same diseases. The only differences are the amounts of each vaccine component. Chickenpox is a viral infection that causes an itchy rash of blisters and fever. Symptoms include rash, tiredness, headache, and fever. It spreads through the air and direct contact. Risks include infected blisters, bleeding disorders, encephalitis, pneumonia, and death. It is recommended that children receive 2 doses of the chickenpox vaccine, which is called varicella, 1 dose at 12 months, and then the second dose at age 4. Polio is a viral infection that can infect the spinal cord and cause lifelong fatal paralysis. There may be no symptoms, or symptoms can include sore throat, fever, nausea, headache, and stiff neck. It can spread through the air, direct contact, the mouth, and stool. Risks include permanent paralysis and death. We have a president that famously had polio, FDR, and so he's definitely a living or an actual example of what it's like to deal with polio post the polio infection. And so it is recommended that children receive 4 doses of the polio vaccine at the following ages: 2 months, 4 months, 6 months, and age 4. Now, polio is one of the vaccines. Sorry. Polio is one of the vaccines that can be combined with other vaccines, and so that's definitely something to keep in mind. Next, hepatitis B is caused by a virus that attacks the liver and causes hepatitis, cirrhosis, or liver cancer. There may be no symptoms, or symptoms can include fever, headache, weakness, vomiting, jaundice, joint pain, fatigue, loss of appetite, and dark urine. Many people do not know that they have hepatitis B. In fact, hepatitis B infection is known as the silent epidemic because many people do not experience symptoms until decades later when more serious issues develop. It can spread through contact with blood or body fluids, which means that mom can pass hepatitis B to the baby during birth. Risks of hepatitis B infection include hepatitis, which is inflammation of the liver, cirrhosis, which is severe liver disease, liver cancer, and death. It is recommended that babies receive 3 to 4 doses of the Hep B vaccine, depending on the vaccine brand. For the 3-dose vaccine series, the first dose will be given within 24 hours of birth because there is a chance that mom has hepatitis B and doesn't know it. And then there'll be a dose at 1 month and then a dose at 6 months, excuse me. For the 4-dose vaccine series, the first dose will be within 24 hours of birth, the second at 6 weeks of age, the third at 14 weeks of age, and then the fourth at 6 months of age. Next, Hib, which is short for Haemophilus influenza type B, is caused by a bacterium that infects the lining of the brain, causing meningitis, which is swelling of the brain and spinal cord. Symptoms include fever, headache, stiff neck, nausea with or without vomiting, eye sensitivity to light, confusion, poor eating and drinking, low alertness, and irritability. Hib can spread through respiratory droplets, and the risks include meningitis, sepsis, epiglottitis, and which is an inflammatory condition of the flap of the skin at the top of your throat, that little flap. Arthritis, cellulitis, which is a skin infection, pneumonia, and death. The current vaccine recommendation for Hib is that children receive 3 to 4 doses beginning at 2 months and one at 4 months. Some children may get an extra dose at 6 months, and then all children get some children get an extra dose, and then all children get the final dose at 6 months. Again, depending on the vaccine brand. Okay, measles, mumps, rubella. Measles is an extremely contagious viral respiratory infection that causes a rash and fever. Symptoms include a rash, fever, cough, runny nose, and pink eye. It spreads through the air and direct contact. And it's extremely contagious. And so one person infected with measles can infect 9 other people. Okay. Measles can also linger in the air for an extended period of time, even after an infected person leaves the room. And so it can linger for up to 2 hours, even after the infected person leaves the room. Risks include encephalitis, which is inflammation of the brain, fever, pink eye, pneumonia, and death. Mumps is a viral infection that causes puffy cheeks and swollen jaws. Symptoms include fever, headache, muscle aches, tiredness, loss of appetite, swollen glands under ears or the jaw. It also spreads through the air and direct contact. Risks include meningitis, encephalitis, salivary or parotid glands, miscarriage during pregnancy, and inflammation of the testicles or ovaries, deafness, and death. And lastly, rubella, which is also known as German measles, is a viral infection that can be extremely serious if a pregnant woman or person is infected with rubella. It can lead to miscarriages, stillbirths, premature deliveries, and birth defects. Rubella can spread through the air direct contact, and symptoms include a rash, swollen salivary glands under the jaw, fever, headache, tiredness, and muscle pain. So it is recommended that children receive 2 doses of the MMR vaccine, which protects against all 3 diseases. One at 12 months of age or a year old, and the second at age 4. A common misconception is that the MMR vaccine causes autism. This is completely false and has been continuously debunked for years. The source of this misconception comes from a 1998 study that was found to be unethical and false. For that reason, the study was pulled from publications, and the doctor who published the study lost their medical license. Studies have shown and continue to show that there is no link between autism and any of the vaccines. So there is no link between autism and any of the vaccines that are recommended for children. Meningococcal disease is caused by the meningococcus bacteria. 2 types of infections that develop as a result of meningococcal disease are meningitis, which is an infection of the brain and spinal cord, and sepsis, which is an infection of the bloodstream. Symptoms of meningococcal disease include sudden onset of fever, headache, stiff neck, dark purple rash, drowsiness, shock, and coma. It spreads through direct contact in the air. Risks include loss of limb, deafness, nervous system disorders, developmental disabilities, seizure disorder, stroke, and death. So there are 2 meningococcal vaccines that adolescents can get. The first is the MenACWY vaccine, which protects against 4 different types of the meningococcus bacteria. And the second is the MenB vaccine, which protects against a different type of the meningococcus bacteria. It is recommended that adolescents receive 2 doses of MenACWY, 1 dose between the ages of 11 and 12, and then another dose at age 16. For those at increased risk of meningococcal disease, the MenB vaccine is recommended between the ages of 16 and 18, in addition to the MenACWY vaccine. You can choose to have your adolescent vaccinated with both MenACWY and MenB. The vaccines can be administered together in a combination vaccine called MenABCWY, but it is strongly recommended that you speak with your child's doctor or healthcare provider to determine which course of action would be best for your adolescent. Next, pneumococcal disease is caused by a bacteria that can cause ear, lung, blood, and brain infections. There are 2 main types of pneumococcal disease: pneumococcal pneumonia and pneumococcal meningitis. Symptoms depend on the affected body part. There may be no symptoms, or there may be symptoms of pneumonia, which includes fever, chest or stomach pain, decreased appetite, chills, breathing hard or fast, vomiting, headache, and fussiness. There may also be symptoms of meningitis, which include fever, cold hands or feet, refusing food, vomiting, drowsiness or unresponsiveness, rapid breathing or grunting, pale blotchy skin, unusual crying or moaning, tense or bulging, a soft spot, a stiff neck, sensitivity to light, and convulsions and seizures. So risks of pneumococcal disease include bacteremia, which is when you have bacteria in your blood, empyema, which is an infection around the lungs and in the chest cavity, sepsis, meningitis, and sometimes antibiotics don't always work, and then death. About 1 in 12 children who get pneumococcal meningitis die of the infection, and pneumococcal pneumonia kills about 1 in 20 people who do get it. And so it is recommended that children receive 4 doses of the pneumococcal vaccine at the following ages: 2 months, 4 months, 6 months, and 12 months. At least seasonal influenza. So seasonal influenza is an upper respiratory virus that infects the nose, throat, and lungs. Symptoms include fever, muscle pain, sore throat, cough, extreme fatigue. Flu spreads through the air and through direct contact, and risks include pneumonia, bronchitis, sinus infections, ear infections, and death. A common misconception about the flu is that it is not a serious illness, especially for children and babies. However, that is not true. Children can develop serious complications from the flu and be hospitalized, and the flu can even be fatal for children. In this past 2023-2024 flu season, there were a total of 187 pediatric flu deaths, ranging from ages younger than 6 months to 17 years old. The CDC reported in March of 2024, when the total deaths was 103, that nearly 90% of those children were not vaccinated against the flu. And so it is recommended that everyone ages 6 months and older receive 1 flu shot annually by the end of October. Flu viruses are constantly changing, and the flu vaccines are reviewed and updated each year based on the most frequently circulating flu strands from the previous flu season. And so, and then to protect children who are younger than 6 months, those who are pregnant should get a flu shot while pregnant. As I mentioned, flu antibodies are passed to the baby during pregnancy and can protect them in the first 6 months of life until they are able to get their own flu shot at 6 months. So in the next 2 slides, we're going to hear from some people who have had experiences with vaccine preventable diseases. This video is of a mom whose daughter passed away from the flu, and this mom urges that parents vaccinate their children against the flu.
My name is Roxanne Benya. I'm from Sinton, Texas. Reese is my youngest child. She's the baby of the family, third born. She was perfect when she was born. The flu affected our family so terribly, and we lost Reese to the flu. My family hasn't been the same. Reese spent the night at her grandmother's house in Taft, Texas. My brother-in-law and I were out doing some Christmas shopping, and he received a phone call. The phone call was from a paramedic that said we needed to go home immediately, that Reese was unresponsive. I took the phone from my brother-in-law and I told them, Reese has been known to have seizures when she has fever. They told me, no, Miss Benya, Reese is gone. There's nothing we can do for her. The drive from Corpus to Taft, Texas was probably one of the longest drives I've ever taken. And when I got there, they already had her in the ambulance, and I wasn't able to see her because they told me that she passed away in her sleep and that the reasons for her passing were still unknown. We wanted to know what took our baby. And the medical examiner said, I'm sorry to tell you, but your daughter, her heart was attacked by type B influenza. Number one thing I want other parents to know is how serious the flu is and what we can do to help our children and ourselves. Get vaccinated. If there's a chance that it's going to save your child, do it. Because I never imagined that the flu would take my daughter.
Hmm. So those who were not vaccinated against vaccine preventable diseases as children are still at risk for serious illness, complications, and death. So this is Joshua and his story with measles. Joshua contracted measles at the age of 30 after attending his sister's graduation. He had no direct contact with anyone else, and so it was determined that he contracted the disease from just passing the infected individual. Remember when I said that measles can linger in the air for a long period of time? That's how contagious it is, or you could just get it from passing somebody. He had not been vaccinated as a child. His parents thought they were doing the right thing by not getting him vaccinated. As a result of contracting measles, as an adult, Joshua became extremely weak and could not walk without assistance. He lost about 25 pounds, and it took him months to recover. He urged his parents to vaccinate their children against measles because of his experience. So, the last part of this presentation, I'm going to discuss what to expect when getting a vaccine, including common side effects, vaccine ingredients, immunization records, ways to make shots less stressful for children, the Vaccines for Children program, and other resources. So any vaccine can give side effects, and side effects will vary depending on the vaccine given. The side effects on this slide were found to be the most common vaccine side effects in children. Most side effects from vaccines are mild and will resolve within 2 to 5 days. The side effects usually occur within 12 hours of being vaccinated. Serious reactions to vaccines are rare, but pediatricians or healthcare providers should be contacted if your child is experiencing or exhibiting any symptoms that concern you. And you should always consult with the pediatrician before giving your child a pain reliever or fever reducing medication. So as the video at the beginning of this presentation mentioned, every ingredient in vaccines serves a purpose. They'll either provide immunity, keep the vaccine safe and long lasting, or they make the vaccine more effective. And as the video mentioned, all these ingredients are extremely safe. Here's where you can get your child vaccinated. Because the vaccines I discussed today are recommended vaccines by the Advisory Committee on Immunization Practices, these vaccines are covered by most insurance companies. For those who are uninsured or for those whose insurance plans do not cover vaccinations, and in that case, they would be considered underinsured, you can visit your local health department, a public health clinic, or a federally qualified health center. So the Vaccines for Children program is a federally funded program that provides vaccines at no cost. Vaccines are free, but there are some clinic sites that may charge an administrative fee. No one can be refused vaccines if administrative fees cannot be paid. To be eligible to receive a vaccine under the VFC program, your child must be under the age of 19, Medicaid eligible, uninsured or underinsured, or a Native American or Alaskan Native. To get your child vaccinated under the VFC program, you can go to a federally qualified health center, a local public health clinic, or a local health department. You can also ask your child's pediatrician or healthcare provider if they participate in the VFC program, but be sure to inquire about any additional costs. It is extremely important to keep track of your child's immunization record and to keep it up to date. Immunization records are needed for schools, colleges, and childcare, extracurricular activities, traveling, adoption and fostering, and even when your child becomes an adult. And so you can keep track by maintaining and keeping safe your own copies of your child's records. You can ask your child's doctor for a copy of your child's immunization records. And you can ask them to enter all of your child's records to New Jersey's official immunization information system. It's called NJIIS. Doing so makes your child's records even more accessible. And luckily for New Jerseyans, we have an app called Docket where we can access our immunization records from our phones. And you can download Docket from your app store. It is available for Apple and Android users. And you can also visit nj.gov to request a copy of your child's vaccination record. The CDC has nine tips that can be used to make shots less stressful for your child. Number one, do your research, read about how to prepare for your child's doctor visit and review any vaccine information. Number two, ask for a sweet solution. Tasting something sweet can help reduce your child's pain response. If your child is 2 or younger, you can ask your child's pediatrician to give your child a sweet solution. Number three, if you can, breastfeed. Breastfeeding is a great way to calm and relax your baby. Additionally, breast milk has a slight sweetness, which can reduce your baby's pain response. Number four, ask for a pain relieving ointment or spray. You can ask them for this ointment or cooling spray, which is applied directly to your child's arm or leg right before the shot. Be honest and calm. Take the time to explain to your child what to expect in simple terms and use calming language. Number six, bring your child's favorite things. Anything that your child finds comforting may help them focus on something pleasant. Number seven, you can distract your child. Pull their attention away from the nurse or doctor by calling their name, singing a song, or acting silly. Number eight, keep in mind that older kids need support too. Let them know that they're getting a shot. Explain to them why, and you can help them take deep breaths and then create distractions. And lastly, take care of your child after the shot. Infants can be calmed by swaddling them. Small kids can be comforted with hugs. And as I mentioned when I went over the side effects of vaccines, my reactions to the vaccines are normal. These are some frequently asked questions that parents typically ask. And for the sake of time, I'm not going to go over them. But what I will do is provide a PDF of the presentation so that you all can see these questions. And some of these I actually addressed in the presentation. Okay. One of the questions that I will go over now is this third question here. Why do vaccines start so early? The recommended schedule protects infants and children by providing protection early in life before they come into contact with diseases. And children receive vaccinations early because they are susceptible to diseases at a young age. Another question that I want to last two questions I want to review are the last two questions here. Is natural immunity better than vaccination? No. It is better to prevent sickness by getting vaccinated rather than getting an infection. I went over all of those risks and complications that come from getting infected. And so I think that the risk of having just a sore arm, or a headache from a vaccine is way better than dealing with things like paralysis, deafness, things like that, death. And then lastly, if a disease is not present in my community, do I still need to vaccinate my child? Absolutely. Even if a disease is not present in your immediate community, it may be present in other parts of the world, and your child can encounter the disease from someone who traveled. And that's exactly what happened with measles and what caused the measles outbreaks. There's a lot of misinformation and disinformation out there, so be sure that you are getting your information from trusted sources. Here's a list of trusted sources whose websites you can visit to get more in-depth information. I will take any questions if anyone has any.
I have one. Well,
Yes.
you respond all of them that I have before, but just the app for the immunization records. Can you
Yes.
repeat that again?
Yes, it's called Docket. Let me go back. I'll go
Okay,
back to that slide. It's called Docket. Hold on. Here we
that's
go. Yes.
great. Okay,
Yes, it's called Docket. Yes.
okay.
And so so we have to put in some information to look up the records, and then it'll pull up all of the vaccines that your child received. If they have been receiving vaccines in New Jersey. I noticed in mine, and it could just because it could just be because I'm older, but not a lot of my childhood vaccinations are in my record. And so I'm actually going to try to see how I can get my docket updated so that it reflects all of the immunizations that I received, because I know I didn't have to catch up for immunizations when I went to college. I was up to date. So I definitely want to do that. But you're able to do that, and then parents are able to have all of their children's records. So if they have multiple children, they're able to have all of the records there, including their own, and
That's
in the
great.
docket app.
That's
Yeah,
great. Thank you.
no problem. Any other questions? I was gonna
Okay.
show my contact information, but oh, it's okay. But yeah, if anyone has any questions, or here we go.
There you go.
Anybody has any additional questions or any information or want to discuss a little bit more about vaccines, this is my contact information, and I can be reached via phone or email.
Thank you so much, Jasmine, for sharing your time and this important information. I'd also like to thank everyone that joined us today. If anyone is interested in sharing this presentation, it will be available on our Family Partners YouTube channel, probably early next week. Again, Jasmine, thank you so much for your time, and I look forward to collaborating with you more.
Thank you.
Thank you, everyone. Have a
Thank
good
you.
day.
Have a good one. Oh, I see Madeline from the partnership is here too. Hi, Madeline.